Researchers at Yale write fentanyl is increasingly taking a toll on the most vulnerable in this country. In 2021 alone, there were 133 deaths from fentanyl among children younger than the age of 5. We must do something to protect these kids from such a lethal drug. Let's bring in our panel, shall we? Dr. Lakshman Swamy, a pulmonary critical care doctor at Mass Health, and Tracy Walder, former staff operations officer at the CIA's Counterterrorism Center. Tracy, I want to start with you. How did we get here?
You know, I think part of the problem is that this is truly a global issue and a global epidemic. You know, we have to remember, really, China is supplying some of the chemical precursors to these drugs. And then you obviously have Mexico, which is finishing the product and then distributing it here in the United States. And I think part of the issue is that we need to take a holistic approach. Yes, obviously, we need to have law enforcement on the ground. I mean, when I was an FBI agent, I never saw anything like what we're seeing now. This is absolutely insanity to me. But I also think that we need to remember about the global nexus of all of this and be putting sanctions on some of these countries. And I think that got sort of forgotten in the beginning of all of this.
You know, Dr. Swamy, I want to weave you in the conversation and really talk a little about the emotional side, because I suppose in some ways you've watched this decline in real time. Can you tell us a little bit about your observations from a physician's standpoint?
Yeah, absolutely. You know, first of all, my heart goes out to this family and all those families. I mean, I have 3 kids that were 1-year-old not so long ago. It's like hard not to be tearing up thinking about this, that 1-year-old. I mean, you know, we see this every day, right? In ICUs across the country, adult and child, we see fentanyl overdose and we see death. I see, you know, people coming in with severe brain damage because they were barely caught in the moment. And it's horrific to everyone involved all the time. It is truly happening all the time everywhere. That can't be downplayed. And to me, in this case with the child in this daycare situation, I think an important thing to remember that it's so concentrated, it's so potent, fentanyl. It's like having a loaded gun in the house or in the facility, right? It doesn't matter that it's underneath the floorboards or something. I'm sure it was out on the floor. Somehow that fentanyl got into this kid's probably mouth. It's a 1-year-old. They put everything in their mouth, right? And it doesn't take very much. It's heartbreaking. It really is.
And you know, Tracy, you talked about a holistic approach, and in fact, we have some video of, because cops are at risk too, right? They don't necessarily trained, or they're keeping up on how to handle it. My question to you is, are we focusing on the right thing? And when we talk about law enforcement, are they able to tackle this? Are they trained? Are they prepared?
So yes and no. I think we are focusing on some of the right things and some of not the right things. And, you know, I'm a parent myself. I have a young one as well. It's my understanding that this fentanyl was on their nap mats, which might have been how they came into contact with it. We have to remember that this daycare did pass a surprise inspection just a few days prior on September 9th, which is crazy to me. And so I think we also need to be looking at some of this. How did that get past inspection? They had pill presses in there. How did that get through a surprise inspection? And that's a little bit mystifying to me. I think law enforcement is in a good place to handle this, but some of the supporting entities to law enforcement are not. And that is part of the issue, one of the biggest issues that I see, because I think had they been trained when they went in to do this surprise inspection, I don't think fentanyl, quite frankly, was on their mind. But I think the reality is it needs to be on their mind, because this is the reality of what we're facing.
And reality in numbers, doctor, I read this statistic. It said fentanyl poisoning in kids up 3,000% since 2013. From a doctor's standpoint, from a medical standpoint, if we're not able to talk about prevention, because obviously it's here and it's getting ingested, so how can we talk about treatment? I mean, I can't believe I'm saying these words, but do there need to be mass education to daycares, to schools? I mean, it's almost, it's stranger than fiction when you say it out loud, but do we need to be having this conversation?
I think we do need to, and it is, you know, one is too many, and it's far more than one. So the way I see it is, first of all, you can't get fentanyl exposed through your skin unless you have like a specially made patch. So, you know, even on the play mat, touching it wouldn't be enough. But obviously kids are touching it, putting their hands in their mouths. It had to either, you know, it's got to go in either through the ingestion, like eating it, drinking it sort of thing, breathing it, right? Or in some cases through a patch specifically like that, or through the vein. It's not happening accidentally in those ways, but it is everywhere. The answer to your question is that there is an antidote, and it's very easy to use. It's naloxone, Narcan. It's now available readily everywhere. And I think that similar to how we have AEDs in gyms and in airports to shock people's hearts when they have a heart attack in the moment and collapse, we need to have Narcan available universally, because fentanyl, unfortunately, is universal. So you can catch it, you can intervene. There was a very brief window to do that with this child.
Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.